Full, glorious hair. It's a big part of what defines beauty.
For a woman, I think it's even in the Bible, that it's the crowning glory.
So when that crown starts to thin,
Mortified. I thought, oh my God.
A lot of times they'll hide it from even their husband.
It's something that we don't like to talk about. It's something that happens to men.
but it happens to millions of women too.
Hair loss is quite common in women. I think a lot of women feel that they are suffering in this alone, but the reality is that 30 to 40% of women will suffer from androgenetic alopecia.
That's hereditary hair loss, and it comes from both sides of the family. While men start showing signs of losing their hair in their 20s.
It is oftentimes difficult to diagnose women at an earlier age.
But now there's a way to know if a woman or a man is at risk for losing their hair.
The test generally takes about 3 weeks.
A simple DNA test can tell if a person carries the gene for baldness.
And when I went to the hairdresser...
Deborah Schilling's hair has been thinning for years.
The hairdresser told me I had a couple of hair loss patches.
I think hair loss in women is often born in silence. And I think women don't realize that there are things that can be done. If you do have this gene, then maybe it's a good idea to start looking for things that you can do to slow the process down.
Using the same medications as men.
Be things like Rogaine, which is a topical foam.
The earlier you catch it, the better the medications work.
And then if a woman is not of childbearing potential, we can even use a medicine like finasteride or Propecia, which is very popular with the gentlemen because it works very well in combination with the Rogaine.
Medications can preserve hair, but are not as effective at regrowing hair.
The sooner you start therapy, the more hair you hang on to.
Dr. Brad Limmer is a hair transplant specialist. He's seeing more women like Mary Beth McAllister.
You get so self-conscious when people look at you. They're just staring at the top of your head.
We're just about done.
But after undergoing her third transplant...
Have you noticed a difference?
Oh, honey, yes, a lot. A lot.
It's really helped.
You're not looking at the top of my head.
The test by HairDX is in clinical trials. Dr. Limmer plans to start offering it to his patients, even though it may cut down on business.
It will allow us to diagnose patients at an earlier age, which I think is critical in helping prevent patients maybe from needing a transplant.
Deborah Knapp, KENS 5 Eyewitness News.